me bring in Dr. Sanjeev Bagai on the program and Vimlendu Jha. Thank you both for joining us. Dr. Bagai, I have to first start by asking you, we've seen in the past 2 cancellations, very visible ones, of artists who refuse to come out and play. Perhaps not so much about what the people who will come there and feel exposed to AQI, but for their own lungs. This is Kavita said, hugely popular, especially with the Delhi crowd. And Palash, who's also a native Delhi wala, by the way, both of them saying that the AQI is just not permitting them to put their own lives at risk. What happens when you sing, perform in like 500 plus AQI?
Right. So I think much has been said about the statistics. First of all, good evening. My apologies. Much has been said about the statistics and the mortality and the morbidity rates, the organs damaged right from the brain, from dementia to heart attacks in the heart and hypertension to lung cancers, bronchial asthma, bronchitis, involvement of the liver, the gut, the spleen, the prostate, cancers of almost 18 different organs, almost increasing by 80 to 90% in the last 10, 15 years. Unborn fetuses, pregnancies been involved. So let's come to what happens in this AQI during exertion, physical activity, or singing or choir. What really happens in these kind of situations is that there is, as it is, a level of hypoxia. That means decreased oxygenation, and your demand is much more in your body during these physical activities. In presence of a extra load on your body, such as stress as singing, your lungs demand more amount of oxygen, which is not there. More amount of breaths being taken per minute during singing means more amount of pollutants and co-pollutants being inhaled and therefore being absorbed. This is more than toxic as it is, but if you're going to exert, run, play, or sprint or have any kind of outdoor activity such as singing, it's putting more load on your cardiovascular system. In routine times, a 10 microgram increase in PM 2.5 gives you a twofold increase in cardiorespiratory metabolic mortality. This will give you a lot more. So there is a direct link, there is a direct risk. We need to be careful. I think now we got to move away from politics. There has to be a Delhi state medical advisory. This is a health emergency. There is no shame in admitting that, okay, things have gone wrong. Let's not play politics with one party to another. Let's draw out an action plan. And I've written on this on Twitter, on social media, on various platforms. We need a 12-point action plan. Trust me, it is doable. The Delhi government has instituted 2 high power committees and bodies, but my request really is let there be a neutral scientific advisory board which advises the Delhi government and the Chief Minister's office directly. And Mr. Sirsa, who I know personally is a good man, strong man, this government can turn it around. The intent has to be clear. The first way to acknowledge that there is an issue is to identify and recognize where the fault lines are. Once that is done, we can find a solution. At the present moment, we
Okay,
have
but
not.
I don't know if, Dr. Bagai, I don't know if the problem of Delhi NCR can be solved, and Vimlendu to come in on that one, by anybody in Delhi alone. We are looking at a northern basin which gets formed across the northern belt, right? We are looking at inversion taking place. We are looking at vehicular pollution, and that's why I keep saying 60% of India has bad air. We've got to sort of get comfortable with that number. We look at metros like Kolkata, where AQI is permanently between 200 to 300. Bombay, no difference over there. Several other North Indian, whether you pick up Kanpur or Lucknow, you pick up Meerut or Aligarh, all of these places have really bad AQI. So Vimlendu Jha, what exactly is the way forward? Should we take China's advice, maybe take their help and understand what exactly did they do? Or is our situation very different?
You're absolutely right that, disproportionately we cannot be blaming Rekha Gupta or Mr. Sirsa. of course, the voters of Delhi or otherwise will ask their immediate leader, and therefore they are the immediate leader. But as you rightly said, the issue is not just of Delhi. Your studio is in Noida. I'm sitting in Gurgaon. I think you should also start blaming your chief minister, and I should also start blaming my chief minister, which I do not know. These two chief ministers are completely missing in that sense. And that brings us to the main issue that if forget about this, if 40 to
Fair point.
50% or majority of India's air is actually bad and terrible, therefore it's important that the Prime Minister or the Union Environment Minister should be here. That's very important. So it's not a Vidhan Sabha issue anymore. It's not a state specific issue anymore. It's a regional issue. It's a national issue, and therefore it needs that national focus. It needs that national budget. It needs that revision in National Clean Air Program. Your question with regard to China's assistance, why not? As China was yesterday's New Delhi, and if they were able to solve it, why shouldn't we learn from them? As if they're extending their assistance. And by the way, extending their assistance in terms of assisting their case study. What did they actually do? They were also very, very populous, a country, very, very aspirational country, very, very industrious in that sense. And of course, the pollution levels very, very similar to India. And what they actually did, first thing that Beijing did was allocated adequate resource for air pollution mitigation, which was actually 15,000 crores, almost 15,000 crores per year, which basically, if you look at India's budget for 6 years, is around 19,000 crores, and for 130 cities, so which comes to an average of 25. So what Beijing did, and Beijing case study should be a very, very important study and learning for us Indians and our policymakers, that you actually spend adequate resources, proportionate resources, first of all, in terms of budget. Then what they did was working on the public transport, not of that the city center or of the Lutyens Delhi or of the South Delhi or of North Delhi alone, but of the entire area which actually caters to this entire so-called national capital territory in that sense, and therefore national capital region. And that's why we need 10,000 buses. 10,000 buses, not just as monuments of public transport and mobility, but something that is used. And for that, you'll have to make it affordable. For that, you will have to make it last mile and safe, and so on and so forth. You don't want empty buses to be plying on the road in that sense. And alongside that, you will have to incentivize vehicular private vehicles, because your study, my study, everybody's study says that 40% to 50% of PM2.5 concentration in Delhi's air is because of private vehicles that are applying. And the more and more, there's almost 20% growth year on year in terms of more cars that's actually being bought in Delhi in that sense. So disincentivize private vehicles. Construction activities. I think, you know what, this in some ways, and I'm being a little this thing, but GRAP should be banned. As in, I've not said this for so many years, because we all hide behind, the government hides behind GRAP. GRAP is just a band-aid. We think we've done enough by just shouting GRAP 5 times, sometimes GRAP 1, GRAP 2, GRAP 3, GRAP 4, and all of it together. And that makes 5 times in that sense. And we think the pollution goes away. Pollution, that's not a solution. GRAP is not a solution. The idea of GRAP was an advisory, precautionary, stopgap reactive measure. But now what has happened is that everyone in the government and in the courts also, everyone depends only on GRAP as a governance measure, and that is doing a large disservice. Of course, the implementation, whatever that
Mr.
little
Jha,
that is there.
you and I have spoken several times over years now on the same issue. We highlight the same matter, the same topics. अभी तक आपको भी रट गया है, मुझे भी रट गया है. Dr. Bagai to has his breathless moment. You know, there is Shankar Mahadevan who has a breathless moment. Dr. Bagai has a breathless way in which he speaks about the issues of pollution as well. But let's not get carried away. I understand that you're saying the government hides behind GRAP. But the point is, this is also required. This year, we've had to fight for GRAP implementation also.
I know.
I mean, at 1,000 AQI, we had kids going to school.
Absolutely, no doubt. I'm not saying GRAP shouldn't happen, but imagine GRAP is the only thing that happens then. You think that you've done your bit. The government thinks they have done their bit. The courts of our country think they've done their bit by just announcing GRAP in that sense, and that too very little, very late. And GRAP is not a solution. GRAP actually looks after some of the symptoms rather than the source in that sense, and it is not long-term. It is only, as I told you, if you look at the documentation, the idea, the rationale behind GRAP was supposed to be precautionary, so that, you know, when you're in stage 3 or when you're in 300, the situation should not become 400, and that's the reason why
no,
you
it's a
put
short-term
certain
measure,
restrictions.
yes. It's a short-term
So
fix.
from that point of view, I'm not getting
but
carried
we need
away.
a long-term.
Fine, at least.
We need a
Absolutely.
long-term solution. Yeah, I get that point.
Absolutely.
But Dr. Bagai, we are missing another important point here. I hear of singers saying, well, my throat will not function. I will not subject myself to this AQI and I cancel a concert. But what about events like the one we had with Messi being here? What about events like that when we've got sports icons, etc.? Of course, you know, those visuals and videos are now viral everywhere of the chief minister being booed. But shouldn't GRAP actually, should somebody have, you know, made better sense? And I'm asking, maybe not done it in Delhi in this air, not subjected people to coming out in the open?
So just few important points. India loses 7 lakh crores every year as a economic loss because of fighting the complications of air pollution. Isn't it wise just to spend half that money in preventing it and therefore preventing complications like death and mortality and morbidity? Point number two, being in clinical practice, a small child which came to my clinic just yesterday, I did a live show on the roads of Vasant Vihar where I stay, said that, Uncle, why don't you add a C in front of GRAP?
What's the C?
Just add a C and then pronounce it. He says nothing happens with GRAP. Okay, there's a pun intended. I will not spell it out. Going forward, I think it's important that all outdoor exposures be limited. Therefore, it is important as a public advisory. It is possible to control the traffic emissions, the traffic congestion. It's important to control the road dust. You can't have MCD workers grooming the roads every morning and reopening the dust which is already stagnant on the ground into open air and remaining suspended for hours. Therefore, it just gets redistributed. Construction norms are in thin smoke. As it is, there is smoke in the air. We have to look at possible solutions and strong implementation. I am again saying it cannot be done in silos. I've said this for very, very long that at least 4 or 5 or 6 major states, alongside with Delhi, have to put their heads together. Let there be a proper national advisory board. Let there be a national guideline. Give yourself a 5 year agenda plan, monitor it every quarter and declare the results every year. Do not wait for AQI to reach 400 and 500. Trust me, AQI of 200 to 300 is long term damaging. 400 to 500 is fatal. Few hours of exposure, let's say like in a stadium, can give you cardiorespiratory mortality. How many death certificates will read heart attack due to air pollution? None.
See,
But
the
the fact
situation
is, it
is
is there
such, no,
because
Dr. Bagai, that situation is such that even doctors now know solutions. Doctors are also saying this is how you will fix an environment problem. But who's listening? Who's going to do this? We don't have
so
a
now,
central ministry to look at air. We don't have ministers who are ready to recognize it. We don't have a parliament is going on in full spell. Nobody's spoken about pollution. And then we are feeling very happy. Oh, they said they will discuss. When will they discuss? And what is the point of discussion? Just implement. You know how to manage. If you can manage COVID, you can manage air pollution. If
absolutely.
you know how you can enforce it across the country, you can get people to wear their masks, you can have advisories, enforce it, get people to understand the problem and the health issues. Why can't we do it for air pollution? And frankly, I'm tired and sick of just saying the same thing every day. But Vimlendu Jha, on the issue of dust, I want to clarify because Dr. Bagai raised it. And I think there is a confusion in people's mind. People think dust is very, very harmful. But what they don't see is PM 2.5. What they also don't understand is what is water sprinkling actually doing? What exactly is water sprinkling doing? Can you explain that to our viewers?
So, okay, so basically, right now, if you look at that budget conversation that we were having, that very little money that's being spent, of course, majority of that is actually unspent in most of these cities that we're talking about. There's some media reports that talk about that only 1% to 30% of that budget that's been spent. And out of that 1 to 30% money that's actually been spent on air pollution mitigation in these 130 cities, majority of that is actually spent on sprinkling water on roadside in that sense. And that's what we've actually done. In the name of air pollution, if you look at every interview or every press conference of Mr. Sirsa or Miss Gupta, in that sense, they've talked about how their so-called road cleaning cleaning or road sweeping or this entire sprinkling regime has changed. As in, there's selfies of ITO and all of that. I think what it does, and what Dr. Bagai was also talking about, that what it doesn't remove dust, it actually settles dust in that sense, and that too temporarily. How much water do you want a river to flow there so that that dust actually becomes sludge and goes somewhere? No, it doesn't. You only are creating mist situation there for temporarily actually settle it. And in many ways, you're only doing it at perhaps maybe say 10 to 15 meters from the ground level. It's not as if PM10 only remains there. PM10 remains in the entire air column that we actually have, the atmosphere, the breathing column that we have. So, right now, when you and were talking about the Ethiopian crisis, of course, the volcano eruption, we saw glass and dust and sulfur dioxide actually travel 4,000 kilometers. And here we are feeling very, very happy that just 10 meters by 10
So
meters we sprinkle
am I to
water.
say that water sprinkling is doing nothing?
No, temporarily it might be, but in the sense, partially for that second. And there are a lot of people with resources are putting these mist fans and things on their rooftop and then their balconies in that sense, so that they get a sense of that. But also there are studies, which Dr. Bagai will tell you, that mist in the sense of humidity plus PM10 and PM2.5 together can also have harmful impact in that sense. So it's not as if it gives you a sense that you're breathing. Some people told me that you apply some oil and something in your nose and it stops. Nothing can stop you, protect you from this. And no machine, no oil, no ghee can actually help you in this. The only thing will be that stop it from where it starts. And that's the only solution. Dust is not the main thing. PM2.5, Dr. Bagai will tell you, is 40 times smaller than human hair and more harmful. It really, that the PM10 perhaps gets stuck at
It's
your
actually
at
irreversible.
the upper level versus PM2.5 getting into your blood and therefore getting into your entire immune system to everything else. Dr. Bagai will be better to
Dr.
answer that
Bagai,
question
very,
further
very,
up.
very quickly.
Very quickly. So, water sprinkling, smoke guns, artificial rain is a big no-no. It's a passe. It's been scientifically proved to be a gross failure and waste of time, money, and energy. It's an eyewash. It's a band-aid solution for a gangrene lying elsewhere. The fact of the matter is that the water sprinklers are dealing with the larger particles and PM10, not PM5, not PM2.5. Second point, it increases the relative humidity in that given area. In fact, what it does is it galvanizes the PM 2.5 to become more active. Point number two, what does the relative humidity do? It aggregates them and therefore the underestimation becomes even more. That means the real value is a lot more. Point number three, what it is giving is oxygen molecules to oxidize heavy metals. No one is talking of it, which then gets supercharged with what we call as cationic particulate matter of plastics. So it's a triple whammy. It does not work. There is research data on this. It cannot work.
It cannot work, and but we still go on to sprinkle because it looks like something is being done. No, it goes on to say, see, the government is spending. It might be hovering around the AQI meters more than people. It might be hovering only in Lutyens, Delhi and other places, but it looks like kuch to kar rahi hai sarkar. So let's do it when clearly we know that water sprinkling actually doesn't help at all. In fact, as Dr. Bagai said, does more damage than good. But like I said, we are still waiting for somebody to put their hand up and say, I'm going to clean up the air of this country. I'm going to provide a solution. We haven't seen that hand up so far. Dr. Bagai has his hand up, and we really hope that the government sort of listens to him and understands that.
So no, we will not relent. We will not give up.
I'm with you,
All
sir.
of us
I'm
will
with
continue
you.
to fight.
It's been a month and a half. I've done every day a show on pollution.
Yes, I know that.
Every day we've brought out a different issue. We've spoken about issues, and that's what I can do. That's what you can do. The rest is like we said.
Absolutely.
The government has
God
to
bless
listen.
you.
And for the moment, Vimlendu Jha and Dr. Sanjeev Bagai, thank you both for joining us.